Okay. So I'm going to go through this material quickly, okay? And I'm going to make a couple of points about implementation, and a couple of points about measurement, okay? So this is sometimes called the implementation gap. Are they awake back there? Rialda, can you ask them to, are they on? No? No interpreter. Okay, I'm going to speak in, do you understand Japanese? Skoshi? あ、日本語わかる人だったら私は日本語で話しても結構でしょ? So I'll speak in Japanese. It's close to Russia. So, are they on now? Okay. Technological problem. We were waiting for Ibrahim. Okay. So this is sometimes called the gap, implementation gap. It's the gap between policy, which is what policymakers like to do. They like to create policy, and what actually happens. Okay? This is what Maggie Thatcher said. Don't tell me what, I know what, tell me how. Okay? So it's translating the things that are on paper in policies into actual changes. So we can think about it as the difference between adoption, which is approving a policy, and implementation, which is actually making it happen in reality. So this is in our policy cycle. We just talked the last session about evaluation. Implementation happens here. Okay, we're not going to talk about this. One reason implementation is hard is that you make compromises in adoption to get it adopted that makes it hard to implement. This is a dilemma. Okay, I'm not going to talk about that. You can look at the slides. This is what I want you to remember. Okay? Implementation involves relationships with lots of different actors. Okay? So that's key point number one. So it involves relationships, and you have to manage each of those different relationships. We heard about that from Octavio, right? In thinking about Mexico. You have to manage the relationship up with the leader. You have to manage it outside with interest groups. You have to manage money, which usually means Ministry of Finance. You have to manage down beneficiaries. Remember, he said the Mexican reform was not driven by the people. Okay? You have to manage within and around people in your own bureaucracy and people in other bureaucratic agencies. And sometimes you have to manage outside the donors, external. Okay? So I have done this in the flagship course this session several times. And somebody said to me, Michael, there's nothing good written about this. So this past summer I wrote something, and you'll get it. It's in your flash drive. Okay? So you'll see it's by someone called Paula Abril Campos and me, Michael Reich. Okay? It's called Political Analysis for Health Policy Implementation, something like that. Okay? And what that does is provide examples of each of these different relationships. Okay? With managing, making something happen is multiple relationships, multiple political relationships that you have to manage. Okay. Any questions about that? The most difficult one is, my experience, the most difficult one is managing self. Yourself. What that means is you have to decide how much you're going to commit, how much of your time, how much of your energy, how much of your passion, how much of compromise. Where do you compromise your own personal values? And, you know, we can think about, again, to go back to a very immediate example, this course. Okay? So for me, as the course director, I make certain compromises. Okay, there's some sessions over which I don't have much substantive control. They happen because they're in the World Bank. The World Bank demands certain things, and I can say something, but it has no effect. So at some point I say, am I willing to continue as the course director for the flagship course under these conditions, or do I walk away? And I've made decisions so far to keep involved, okay, managing self, my time, my energy, in order to continue this course, because I believe implementing this course has value. I can give you more details sometime if you want. Okay, so these are 6 political economy challenges to implementation. Each one of these relationships, they're in the slides, and they're examples. Okay, so interest groups. We can do a quick example. Should we do examples? Let's not do examples. I think this is clear. Interest groups, each of these has examples in here, and you can look at the slides and you can think about them for yourself. And we've talked about them. Actually, the last session talked about all examples of this. Okay, I'm going to take you now to the second point about implementation. Second point about implementation is that you need not only the individual, yourself, you need your team. And you need a team to drive delivery. So if it's a big reform and a big change, you need a team that will drive delivery. And the one that I like is this one. It's a guy named Michael Barber. Okay, and again, the article is in your book, in your slides, in your flash drive. He was an advisor to Tony Blair, the UK government, and he created this idea he created a word, deliverology. Deliverology, which means the science of delivery. Okay? And what he said, it's not really a science. Okay? But what he said is you need to have a team that will create a foundation. Okay? Define your aspiration, review the current state, build the delivery unit. Okay? Then the next is you have to understand the challenge. You need to analyze it, do your diagnosis. You need a plan, you need targets, and you need to establish routines. So he has a manual on how to drive delivery. Okay? So that is, that is a 10-minute summary of implementation. The two key points are, number one, look at the key political relationships with the different groups and players. And number two, create a unit that will drive delivery. Any questions? Comments? Okay, we're going to move to measurement. Okay, why do we care about measurement when we're thinking about health system strengthening and health system reform? Why do we care about measurement? Who would like to speak? Why do we care about measurement?
Irene, because we need to know if the things we're doing are actually changing something.
So one reason is we need to know impacts, whether what we're doing is having an effect. Anything else?
We need to manage the process.
Say more.
Like if anything goes wrong, we can manage it if we can measure it.
Okay, so the first was whether what we're doing has an impact. And the second is we need to know whether it's the right impact, but also if we're going to the right place, and whether there are other things going on that we need to deal with. Okay? What else? Saroj?
Because when we are going for universal health coverage, definitely we've put in a lot amount of finances there. So we want to know whether the decisions that we took, are these finances going to be utilized in the proper way, or it is just, the story is just the same what it was before.
So this is accountability. Okay? We put money into things. Is the money being used appropriately? To put it in other terms, is any of the money being used inappropriately? Okay? To make sure, so this is government money, it's public money. There's a responsibility to make sure that the money is used according to the rules and according to the objectives. So it's both a moral responsibility and legal responsibility. Okay, any other reasons why we measure? Why do we measure?
Over there.
Moldova. Yes, please. No, you don't have. You're part of the silent group.
So measurement is necessary to see to what extent the result has been achieved in contrast of target outcomes or all target or objectives.
This is so whether what's achieved is close to the targets. We set goals, we set targets, things we actually expect to do, and the question is, where are we with regard to the targets? It's an interesting question of whether we should set targets that are achievable or whether we set targets that are aspirational. Okay? Targets that we think we can actually do, or targets that we know are impossible. Do you have a thought about that? Do you have a thought about whether we set targets that we know we can achieve or targets that we think we know we cannot?
So it depends on an assumption. Some targets are achievable and tangible, so we can put as a much more concrete and to have very concrete steps how to achieve them in terms of time framework. And also we have some aspiration, we have some assumptions, which also is important to put in the front. And by this is much difficult because it's much larger. We need to assess the perception, we need to assess values, we need to assess in general political environment.
This is, I get into debates. Remember, I'm not an economist. I get into debates with my economist friends who say, only set a target if you can achieve it. Okay? And actually, you want targets or goals sometimes that you know you can't achieve in order to drive people to work harder, in order sometimes to drive technological innovation, to make people think of new creative ideas. Okay? So it's yes.
I just want to voice my frustration because here we're talking about setting realistic targets and we're at the World Bank, and the World Bank is actually the entity that pushed us to set completely unrealistic targets in our project in the World Bank, which we've told them many times and are still voicing them to this day, and we're being ignored.
So why do they push you to do that?
They think they know better. Although we've been implementing for 5 years, we do know what we're talking about.
This just underlines my point that part of implementation is managing the relationship with the external donors. Okay? So, and they're going to push you, and they're going to hold the money, and they're going to say, if you don't do this, you don't get your money. So my response is, don't be so frustrated. Okay? So you have to manage that. You relax. Okay? You have them sign on as co-responsible for setting the goal. Okay? Okay. Okay. So this guy, does anyone know who this is? His name is Deming. Deming. D-E-M-I-N-G. One of the planning cycles, and he was one of the originators of the ideas about importance of quality improvement. Okay? And many of his ideas have been adopted actually initially first in Japan before the United States. So among the things that he is thought to have said, if you can't measure it, you can't manage it. If you can't manage what you don't measure. If you can't measure it, you can't improve. He actually said none of these. What he said, it's wrong to suppose that if you can't measure it, you can't manage it. This is a myth. Can you think of some examples of things you can't measure, but you can still manage or improve? Patient, who said that? How do you know patient satisfaction if you don't measure it? Saras, push your.
It's very difficult actually.
It's what?
It's quite difficult to measure patient satisfaction.
It's quite difficult to measure.
Yes.
Okay. Can you give me a concrete example of something that you can't measure but you still improved it? Or that you didn't measure, that you still improved? Examples? Yes?
I hope this is going to be a very good example. I hope. In Ethiopia, we have this nationwide service expansion program, which we did all over the country on education service and health services. Now, they ask us to measure it in terms of impact evaluation. We can't. You can't do impact evaluation with a nationwide project. But we improved services because we invested a lot of money.
Any other ideas? Any other examples? Where? You.
In our country, we've done something like that, but with infrastructure. We didn't made any measure, but we just improved it, and it was big.
Okay. So the message here, let me give you another concrete example. Going back to our own environment. Okay? We didn't measure it, but we know the quality of this course would be improved if we had another handheld microphone. Okay, we don't know how much it would be improved, but we were, for structural reasons, limited resources, we are unable to get another handheld microphone. Okay, or a clip-on microphone for me to wear or the other teachers. Okay, these are things that would probably improve the quality of communication. Okay? We don't have to measure it. There are things you can do. without measurement. Measurement costs money, takes time. You can still improve some things without measuring it. Okay? Deming said, if you go onto Google, you type in Deming, there are lots of things Deming said. Okay? In God we trust, all others bring data. Okay? So part of what we are learning in this course is how to bring data and how to present data and how to argue with data. Okay. I'm going to give you, so the first point about measurement is you can make improvements without measurement, but measurement can help your arguments. Okay? That's point number one. Point number two, we're going to look at two different kinds of measurement in thinking about the journey to UHC. And I wanted to thank, I forgot your name. Oksana. In the previous conversation, she talked about the journey to UHC. Who's on a journey to UHC? Journey to UHC? Journey to UHC? Yes, journey to, we are all on a journey to UHC. We may not get there in our lifetimes, okay? But we are on the journey. I'm thinking I should write a paper about the difference between journeys and paths. We may not be on a path, but we're definitely on a journey. Each one of your countries has to decide your own path. What do you do next? Okay? We're going to talk about, and measurement, and the question is, let's think about this. The question is, what do you measure on your journey to UHC? Okay? Can someone give me some ideas of things that you would like to measure for your country, for your journey, for moving to UHC? Who said? We'll take three answers, okay, from some perspectives.
We want to know how efficient is our journey, so we want to measure cost we invested in the health of population.
Okay, so how much you're spending and how much it costs. Those are two different things, okay? To think about efficiency. Who else wants to talk about what they would like to measure on their journey as they're moving towards UHC? We'll give you each one choice. Financial protection?
To what extent, we would like to measure to what extent the population is covered by health insurance, for instance, which protect from catastrophic expenditure.
So we want to know both what percent is covered, as well as what happens to the people who are not covered. Okay? What does it mean to have catastrophic expenses, and what proportion of the people have those? Okay? That's measurable. What else? Anyone else like to think about something?
Yeah. Utilization of services, packages in the hospitals.
Okay, so one of the question is utilization of which services?
So it would be like, since you're going for a universal health coverage, and if it's only the tertiary care or maybe the secondary and tertiary care, so you'd see like there's a WHO data saying like what percent of population goes to hospitals, number of sickness rate and also.
So one of the questions is utilization of certain services by certain populations. Okay, so that starts to turn the journey into certain populations for certain services and how you choose and justify them. Anyone else? We'll give one more. Yes?
Improvement in health status of the community.
How are you going to measure health status?
The health status, it's like on the morbidity and mortality.
Of what?
For example, maternal mortality, infant mortality.
So here again, it's a question of making choices about which population group, which mortality, which morbidity. Would anyone like to say anything about satisfaction? Eliza?
would definitely measure citizen satisfaction as well. I mean, in fact, I personally would love to do all of the intermediate outcomes and then all of the high level outcomes that we had listed on day one. That would be the ideal.
The ideal would be some kind of dashboard, right? That would give you intermediate outcomes and ultimate outcomes in a way that provides a visual presentation of where we are and where we're going. Okay. For the conclusion on measurement, I'm going to tell you about two approaches to measurement. One is a global comparative measurement, and the other is a country-based measurement. I'm not going to go into details here. There's a series of papers that are being done by the WHO and the World Bank on measuring progress towards universal health coverage. They come up with a definition, and they use what they call a mash-up index. That's the technical term. That means it's a composite index for which existing theory and practice provide little or no guidance for its design. Those are their words. So they select a bunch of services. They put it all together like mashed potatoes. Do you know what mashed potatoes is? Potatoes that get mashed up with a fork. Okay? And use that to compare countries. They did it with combining service coverage and financial protection. This is their explanation. Okay? And they produce one measure using service coverage and financial protection. No inclusion of satisfaction in this measure. Okay? And these are the explanation. They select certain services. They select certain services for treatment. They select certain indicators for financial protection, and they come up with these kinds of products. Okay? My suggestion, which is a critical suggestion, is that this global approach is useful if you want to compare countries. It is not useful if what you want to do is to make a decision in your country about what to do next. Okay? This is useful for the World Bank and the WHO to create some artificial index for comparison and say, you know, Moldova is 3 steps ahead of Albania, which is 2 steps ahead of Kyrgyzstan, which is 1 step ahead of the United States. Okay? But that does not help. Actually, if you were in your country and wanted to improve the index, you would go back and improve those specific services that go into the index. Okay? So then we can talk about a country-based approach, and this is what I think each of you actually needs. And this is, for Turkey, they had some basic health indicators, they had some financial risk protection indicators, and they had some citizen satisfaction indicators. So they did what, is it Elisa or Eliza? Elisa said, which is actually to create a country dashboard for indicating where you are and implicitly saying where you want to go next. Okay? And that requires surveys, surveys, surveys. It requires money. It requires people. And it requires some ideas from a leader about where you're going and how you want to get there. Okay? So when you think about measurement, you have to recognize that it's political. It's political in setting the targets, selecting the evaluator, transparency of the measurement, and measurement for objectives. Okay, and if you want to implement a country-based approach, which is what I think you should be doing, here are some steps. Okay, and it is combined with the ideas before about the delivery unit. Okay. That's it. So I'll leave you with this. Okay, and I'd like to spend, I've taken a little bit longer. I'd like to spend the last, we'll go, Nadim, for another 6 minutes on reflections on your key lessons for the course. Okay? So we've been doing this now since last week, Monday. You guys have been through lots of sessions. Okay? And I'd like to know what is one idea that you have picked up that you're going to take home and reflect on. So your takeaway lesson from this entire, this is an intense experience. It's designed to be intense, to try to change the way you look at and think about questions related to your health system. So I'd like to conclude here with 3 or 4 takeaway lessons from the overall course. You provide those lessons, not me. Okay, so you need to.
The one that I personally liked was that health expenditures are not expenditures, they are investments. And from these investments, the dividends from these investments arrive at different spheres, industries, civil sector, state sector, corporates.
Good. So part of what you need to do is to persuade others that expenditures in health are not expenditures, they are investments that have returns in lots of different, in some way you can think about the returns in terms of health, risk protection, and satisfaction. Okay, other thoughts?
I think one takeaway message is the idea that we need to take a step back and invest more time in thinking about how we want to frame our problem and the benefits of certain solutions and what we want in a way that would make people respond to us, and particularly policymakers, and maybe reflecting on the political strategies, as you had mentioned. Because most people who make decisions, they're not technical people, and you need to approach them in a way that they will understand.
This is a great point, okay? The language and the words that you choose, which is the way, as Rohan said, it's the framing. The words you choose make a difference. And you want words that will create images for the policymakers and for the people, where people will respond positively. I sometimes say, think about explaining it to your grandmother, right? And say it in ways that she will understand and relate to, both in terms of what the problem is, as well as what the solution is. It has to be in terms that are simple enough so that people can say, aha, yes, I agree. If it's too technical, it won't work. I mean, it may work technically, it will not work in terms of persuading people to understand and agree. Okay? Any other broad takeaways?
in the next year, we will plan our guaranteed benefit package for the country, and we thought it's going to be easier. We will just recalculate and do some math modeling and things like that. And we didn't thought about the ethics and about these things and talking to the society and deciding like on the nationwide what are we going to pay for.
Really good point. You know, the benefit package is really where lots of these points become concrete. They become very specific. And in some ways, the title of that book that people kept referring to, What's In, What's Out, great title. Okay? And that's really what you're explaining to people. And it touches on ethics, it touches on finances, it touches on interest groups, it touches on the people, because it determines who's going to get better and who's not going to get better.
Thank you. How important is for us to hear the voice of the patient, to put the patient in the middle of our services, because they are the value for our country. So the key message to take with me is to hear more the patient and to give what they want.
I think this is a great point. This goes back to the role of satisfaction. And as we've said all along, it's not easy to measure satisfaction. It's not easy to put the patient at the center. You know, because they're not organized, or they may be organized, but they don't have access to the mass media. Technology may give you new opportunities to hear the patients more. Maybe you want to create a patient's organization or support it. Maybe you have co-governance, okay? But putting the patients at the center and hearing the patients. Great point.
Putting analysis before solutions and going through all the steps of the knobs.
So, you know, one of the challenges is actually developing the capacity to do good analysis. Where good analysis means something that is done to a good standard, but also done in a reasonable period of time and presented in a way so that the policymakers can understand and the public can understand. Technical analysis that no one understands doesn't help you solve problems.
As India is also moving towards universal health coverage. India is also moving towards universal health coverage, or UHC as we call, through two-pronged approach. One with the comprehensive primary health care and another with financial protection under Ayushman Bharat. So as a part of the nation, we are also going for universal health coverage. So it would be a good time to have some indicators by which we can measure how much we have gone ahead and what should be our path. So that will be a good takeaway for us.
So it's interesting to think about these both, which is providing access and use for primary health care, which is the low-cost, high-probability events, and the hospital services, which is the lower probability, high-cost events. They're two very different kinds of services and different kinds of protection.
That implementing what could seem like a logical technical approach could have unintended consequences if you don't think about the incentives that it can create.
Implementation can have unintended consequences. It may be even true that implementation will always have unintended things you don't know about that will happen. And managing the process of implementation in the same way that we manage the implementation of this course, which is to say, okay, you know, cut off half an hour on lunch, cut off, well, sometime from my presentation, flexibility to help you achieve your goals, which in this case is a positive learning experience. You need to be able to manage the different relationships. Okay? Good. Last chance. Anyone else? Okay. So we're going to move now